I'm Katie Griffith with Bright Solutions. We do technology consulting exclusively in the senior living industry. And I'm so excited to bring you a conversation about how AI is being utilized today in senior living. And I'm really excited to have my guests to share how they're leveraging AI. So, Dillon, if you could introduce yourself.
Yeah, first, Katie, thanks for having me on. Excited to have this conversation. My name is Dillon Painter. I am a project manager with Priority Life Care.
Awesome. Well, thanks again. And if you want to just start out by sharing with us a use case or two that you're
Mhm.
seeing with AI in some of your communities.
Sure. Yeah, so I think at a high level, so as part of my job, it is trying to stay ahead, continue to be innovative, find strategic ways to deploy AI. And obviously, I think in our conversation, it's a really trendy and buzzy thing in senior living, and not just senior living, but really in our entire culture and society today. But for me, there's really four buckets that I try to identify where we can potentially use AI to help us. First one being predictive analytics, the second one being data management, the third one being personalized experience, specifically for our residents. And then the last one is operational efficiency. Um, Going into a specific use case, so I'll go ahead and start with predictive analytics. Um, I'm a passionate believer that the landscape of healthcare has changed post 2020, post pandemic. And so you're seeing this rise in technologies that are in the preventative health space. And we're really fortunate as a company. We've partnered with two really specific that I'll call out, Safely You, and then the other one is Toy Lab. Safely You is fall detection and prevention technology where they have AI enabled cameras that can detect over, I think, 99% of on the ground events, which then triggers a notification to our team and our staff. And then the second one, Toy Lab, which I believe they've coined, they're the world's first AI toilet seat. And what this does is it's passively monitoring human output for us to enable better health and wellness within our residents. And so those are two specific examples.
That's awesome. I'm familiar with both of those organizations and their solutions. And I love the four categories that you kind of place this in and
Mhm.
areas and where AI is going to make a difference. And I wholeheartedly agree with that. And I just think, the information that we have today, just in all of these different systems that we're utilizing across the organization, just AI's promise is really we can just leverage that data so much
Yeah.
more efficiently and effectively with the
Mhm.
things that we just have in place now. And then, of course, when you're adding like a Toy Labs or a Safely You, it just propels that even further and being able to get that full picture and see. I was talking to someone the other day and saying it's almost like from a care perspective, especially being short staffed, it's almost like if you're waiting tables, if I could just know that, okay,
Mhm.
everyone's plate at the table is like 75% empty. So now I should take them the check and just knowing like where to go, who to pay attention to, what they need
That's
at
right.
that
Yeah.
moment without having to just walk around and go, hi, how's it going? What you need, which
Mhm.
we still want to do that too, but just being much more efficient and engaging in like really meaningful work.
Yeah, absolutely. And I think it's a conversation I have with a lot of people, and we have more access to more data than we've ever had at our fingertips. And for us and for me, data doesn't mean anything if you can't have action items with it. And so some of these partners that we work with, exactly to your point, it allows us to make real-time decisions with real-time data that we're receiving.
Yeah, absolutely. There are so many opportunities, and there's not just endless time and money to be spent on pursuing these projects.
Mm.
So how do you decide like which opportunities you're going to pursue with AI?
That's a great question. And so Priority Life Care as a third party manager, we work with capital partners. And one of the things and a lot of initiatives with these capital partners is really trying to find competitive differentiators that we can put in our managed communities that the other ones down the street don't have. So I think first and foremost, when you talk about cost, these things aren't always cheap. Actually, they're quite expensive, but getting the buy-in with your partners and for us with our ownership groups we work for, and they believe that this is also the future and really the present. I think that's for us the absolutely critical piece to some of what we are doing. But then really at just the management level as a management company, thinking through for us, how can we continue to prioritize resident safety, for example? How can we continue to give residents a personal, customized experience, which is going to keep them in our community? And obviously, length of stay is something we track regularly as a KPI. So it's really just identifying what's important to us. Those two that I mentioned are very important to us. And then getting the support of capital partners, getting the support of our broader teams and the community teams is also critical.
Yeah, absolutely. And I love how you're talking about, well, what are we trying to achieve as an organization? And that's how we make these decisions. It seems like obvious, but a lot of times people get really excited about a shiny object. I know I do.
Yeah,
And
same. Guilty.
and you gotta just be disciplined and say,
Yeah.
okay, is this going to have a big enough impact on these strategic initiatives and our values and our mission, which are behind you right now, your values and your mission.
That's right.
And
Yep.
so keeping those at the forefront and saying which of these opportunities is going to most impact us and get us further towards where we're trying to go, and being really disciplined in that. But on the other hand, moving forward quickly. And I feel like that Priority Life Care does such a good job of just keeping that machine going and striving
Mhm.
towards more from an innovation perspective. And I think that's so critical to not just
Mhm.
throw your hands up and go, well, I don't know, there's so many things out there
Mhm.
and everyone is telling me at the exhibit hall that I need their solution and they all sound great. So how am I supposed to decide? And so having that discipline of identifying what's going to be important for your organization and leading the charge instead of just letting all these other voices kind of pull you in all these different directions.
Yeah,
With the
absolutely.
Safely You and the toy labs, what results are you kind of expecting to see out of that?
Yeah, so I think the first one is there's KPIs that we track at the community level, whether that's falls, whether that's ER hospital visits. And so implementing these technologies that again, I don't know if they call it this, but I certainly do in the preventative health space. We're trying to get ahead of crisis before it happens. And so we've seen massive decrease in things like hospital visits, things like falls with our toy lab constantly every day monitoring that human output. There's thresholds and there's markers in place that if something isn't right, we can now be told weeks in advance for something really not being right with the resident. And so overall, it's keeping our residents safe, it's keeping our residents healthy, and it's keeping our residents in the communities that they love and that we love them being in. And again, a lot of that goes back to this idea of preventative health, and we have specific KPI that we're tracking along with that.
Yeah, that's awesome. I also see in some of the communities I'm in, it's such an arduous task to, once a resident has fallen, or hopefully before they've fallen, we can identify
Mhm.
some things, but
Right.
definitely after a fall has
Yeah.
occurred, we're able to say like, okay, we're getting all this information about what happened, like,
Yeah.
what was leading up and what interventions should we put into place for this resident to prevent future falls. And I feel like so much of that is relying on a tremendous amount of work that they do a great job of it, but teams of people coming together and kind of piecemealing all of these data points and information. And again, I think they're doing an effective job, but
Hmm.
I'm like, can we just feed all of this data, even like historical
Yeah.
data where AI can say, hey, you're kind of missing something that
Yeah.
maybe you didn't notice before, or maybe this intervention would be better because, by the way, they're on this medication, and draw all these conclusions that maybe we just are missing, or at least at minimum, making that job so much more efficient.
Exactly. Exactly. I think another really, really strong push that we have here at PLC is deploying AI in a way that allows the people who are doing the real work, and I say that as in the people at the communities, right? I'm at our home office. I sit behind my computer every day for 8 hours. I'm not dealing with the same challenges that our community is dealing with. And so, with that in mind, what can we provide them as a tool that can help them be more efficient at their job? And then, even more important, how can we give them back time to spend that time with residents, which is ultimately at the end of the day, like that's where the impact is. And so
Yeah.
having some of these technologies in place that's doing a lot of the work that they manually had to, like you said, piece together multiple sources, multiple data points for then it to tell the story. Well, now here's the book. Like here is the story. And
Yep.
I think that's a big part of our deployment of AI. And honestly, in a lot of places, that adaption and adherence at the community level is a challenge. But when you're able to start to tell that story, there's a lot of buy-in. Absolutely.
Yep. Awesome. So, what advice would you give a senior living organization who's just starting to kind of think about their AI journey and where they should begin, or just any advice in general once they start to pursue AI?
Yeah, I think some good pieces of advice, and I mentioned this early in our conversation, is deploy AI to help you continue to reinforce what's important for your organization, for your communities, for the people that work there. And you do that by there's so much AI out there. There's so many technologies that I think just maybe even say the term AI. Do a really thorough analysis and take your time meeting with different companies, evaluate the cost benefit ratio, evaluate the short term and long term impact. Like you really want it to be a partnership that's lasting and not something that's just like flavor of the week. And I tell you, if we said yes to everyone who came knocking on our door, like our entire communities would look like a spaceship. You just can't do that. And so, really being thorough and deliberate with what you're seeking out, what problem are you trying to solve, goes a long way when you start to think about these things. And that's something that is absolutely critical for me. And then focus on the training to the actual workforce that is going to be using this technology. You know, you have to make sure that the change management is in place, that a community is ready for this type of change, because for some, depending on where you're located, it's such a paradigm shift from what they've ever done. And so I think really focusing on training is a big piece of advice I would give. And then lastly, prioritize the resident, prioritize the staff. Any decision you make, I think it goes a very long way if those two stakeholders are at the front of those decision making, because ultimately this is who it impacts.
Absolutely. Anyone that knows me knows that I was cheering when you said change management. So
Yeah,
it's
yeah,
so
there you go.
critical. You can have the best laid plans, you can create the most
Mhm.
amazing solution ever, but if they don't adopt it in the way that's intended to be adopted, you do not get any results. And
Yeah.
then you just get frustration. I think
Yep.
it's a great opportunity to really develop and continue to impact your culture when you're going through a change like that by messaging it correctly, listening first, and then articulating how these changes are going to make their lives better. And of course, dispelling any fears around like, we're just going to take your job. I don't know how they would be concerned about that at this in this state.
Well, you know what though?
But
It's that's such an interesting point. In my job, it's so unique because I work alongside our executives. one day or 1 hour of the day I'll be talking with our CEO, and the next hour I'll be talking with a housekeeper at a community, which makes my job so interesting because I'm constantly getting perspective. And one of the perspectives, another hot topic is robotics. There is a bit of AI intertwined with that. And we had a community who associated robotics with people and associated with people with losing my job. That's absolutely not the case. And so it's so interesting that you mentioned that, because those are
Yeah.
conversations that depending on the location, we still have to have. No one's losing their job. This will never replace a human.
That's right. And but it is drastically going to change the way that we work. And maybe
Yes.
not as drastic yet, but in the next 5, 10 years, I mean,
Yes.
we're not going to, we probably won't recognize even the org chart but it doesn't mean that we are changing the people that are with us or anything like that. It's hard for us to comprehend today, like how drastically
Right.
our work will change, but that's happened many times in history. And you know,
Yeah.
it's just
Yeah.
one of those inflection points that's so exciting, but you have to be very communicative about, the change. And yeah, this isn't replacing, it's just evolving your
That's right.
role, right?
Yeah.
Mhm.
And especially in the next 3 to 5 years with the workforce, the actual demographics of our workforce, it is going to massively change. And if you're not starting to think about that future state, using things like AI to help continue to be productive, in my opinion, you're already way, way behind, because the challenges we're facing now in the work with staffing here in 3 to 5 years is going to be even greater. So you
Yeah,
have to be at the forefront.
that's right. Well, thank you so much for
Yeah.
sharing with us today. I think it's going to be really helpful and valuable to a lot of folks. So I really appreciate you taking the time, Dylan.
Yeah, absolutely. Thank you, Katie. I appreciate it.
All right, take care.
You too. Bye bye.